Please be welcomed in my humbled channel. My name is Pedro Ribeiro. I'm a psychologist from Portugal, and I also deal with hypnosis, and it's a big part of this channel and my work. So today I'm gonna speak about hypnosis, especially hypnotic inductions. If you are familiar, or at least a little familiar with hypnosis, you know that at a certain point in the beginning of the intervention, the therapist does something that seemingly transports the client or the patient, as you prefer, to a different state, or a different state of focused awareness, or focused attention. That procedure, or that movement, that therapeutical movement or hypnotic movement, as you prefer, is called the hypnotic induction. Well, the first hypnotic induction that probably the literature describes is the eye fixation induction by James Braid, one of the fathers of hypnosis. The principle of the eye fixation is we focused our attention in a certain object, and we focused all of our attention and our mind into one idea, into one concept, into one emotion, or into one suggestion. That is why Braid also described this process as monotheism, the idea of focusing on one particular concept, idea, emotion, behavior, whatever. So in the years that hypnosis developed, a lot of hypnotic inductions were devised, created, experimented on. So there are a lot of ways into and to facilitate the hypnotic state, the hypnotic procedure. However, from a learning standpoint, some of you might ask yourself, what is the best induction? What is the most powerful induction? Please tell us. Please teach us the one and truly induction. And the answer is, drum roll, none of them. There is no particular hypnotic induction that is better than all the rest. That simply does not exist. And the problem is, if you do some research, and if you are in the position that you want to learn hypnosis, and okay, I'm doing a Google research as to what is the offers, what is the main courses, what is the truly the most powerful and the most efficient way, or to put someone into hypnosis, you might stumble on a lot of courses that try to sell you the idea that their method or the induction methods are the best, and that simply isn't true. What is true is that everyone is different. Everyone has differential characteristics that makes us all different from each other. Despite we are all human and we have a brain and we have all the specific organs, we are different from each other because our personalities, our characteristics, our histories, our way of living, and the way that we perceived and the way that we view life is substantially different from each other. So what happens is that when you are in clinical practice and someone enters at your office or your space, wherever, you realize that that individual is substantially different from from other clients or other patients that you have. In that sense, therapy must be tailored, specifically tailored for the characteristics of each client or patient. That was one of the mantras of Milton Erickson, the father of modern hypnosis, and that's an interesting concept that that psychotherapy integration is moving towards. So it's not the technique, it's not the some of the theories, is more the relationship and how you establish the relationship with different clients and different patients. So in that sense, when you think about hypnotic inductions, the hypnotic induction is a procedure, is a ritual that in some cases might be excluded. For example, social cognitive perspectives or theories into hypnosis say that hypnotic induction is merely a ritual. All the power, all the momentum is in the suggestion, and other perspectives really value the hypnotic induction as a phase, as a procedure inside hypnosis. So whatever you prefer, it's up to you. What I can say is doing a hypnotic induction or doing something that is considered to be hypnotic, or that the client or patient can perceive has to be hypnotic. It certainly helps from the expectancy point. What I mean is, if someone perceives that what you are doing is hypnosis, is hypnotic, is suggestive, well, the expectancy of experiencing hypnosis starts to grow, and that helps you and helps the client and the patient and helps the relationship. The way that you start to develop that sense of hypnosis is like the rest of the hypnotic procedure, is tailored, or it's really analyzed in terms of the characteristics of the client or the patient. For example, relaxation-based inductions might not work with someone who has a high level of anxiety or doesn't know how to relax. Hypnotic inductions that demands or implies that the closing of the eyes may be troublesome for someone who has control issues, or who doesn't feel secure in your presence, or in the relationship. So you have to think about the person, think about their situation, think about their history, and really tailor your approach. That doesn't mean that you don't use one induction more than others. Certainly you can do that. A lot of people don't have problems with the eye fixation induction. A lot of people don't have problems with the almond induction, or others. So yeah, it's logical that you can use one or a couple of inductions more than others. But assuming that one induction is all that you need in clinical practice is just dumb. It's stupid. The idea of the one induction as a one tool to everyone came from street hypnosis and really entertainment and shows. But street hypnosis and shows have some tricks. They're not truly genuine, as you may notice. So when translated that idea to clinical practice, it falls apart. The idea that you tailor a person to one induction is stupid. You don't tailor the client, the patient, to procedures. You tailor procedures to the client, to the patient. So, in conclusion, there is no induction that is superior to others. There is no the one induction. That idea is simply stupid. It's simply dumb. It's created to sell a product. But as you know, if you are a psychologist, a psychiatrist, a psychotherapist, a physician, you know that there isn't 100% success procedure. That simply doesn't exist. So if you can't have 100% success in your job, in your approach, then it wouldn't be logical to think that there isn't one induction that can offer you 100% success? I think it's logical to assume that. Thank you for your time. Please continue to be safe and healthy. If you like these kind of contents, please subscribe to the channel, and I'll see you next time.